Good morning, good afternoon, good evening, everybody, depending on where you are joining us from today. And a very warm welcome to today's webinar, the fourth and the final one in a series looking at the threat of drug-resistant infections and how we can address this in a time when all of our lives are dominated by the ongoing COVID pandemic. My name is Jeremy Knox. I have the pleasure of being the moderator for today's session. I'm the policy and advocacy lead for the Drug-Resistant Infections Programme at the Wellcome Trust, based in London. It's been our great pleasure to have played a role in organising this webinar series in partnership with our friends and colleagues at the Antimicrobial Resistance Fighters Coalition, the University of Minnesota Center for Infectious Disease Research and Policy, CIDRAP, the American Society for Microbiology, the Surveillance and Epidemiology of Drug-Resistant Infections Consortium, CEDRIC, and the US CDC. Quite an impressive lineup of acronyms. I'm delighted that, as we have had throughout this series, we'll be hearing today from a stellar lineup of panelists from a variety of sectors and backgrounds, all of whom have very well-established positions within the AMR community. Over the course of the session, we'll be hearing from Nana Kuo, a senior health advisor in the Office of the Secretary General at the United Nations in New York, Murphin Mapundu, who heads up the REACT Africa group, Michael Craig, Senior Advisor for Antibiotic Resistance Coordination and Strategy at the US CDC, James Anderson, Head of AMR for GlaxoSmithKline, and last but very definitely not least, Kathy Torkington, who's Director of Health Programs at the Pew Charitable Trusts. So quite a lineup, I hope you'll agree. But before we hear from our panel, let's look at the context and objectives of today's session. Throughout this series, we've been exploring the question of how our shared, and I think it has to be said, often fairly horrendous experiences of living with one nearly untreatable virus, the coronavirus, shape how we react and respond to the slower moving but no less deadly looming threat of untreatable bacterial and fungal infections. Let's first think about the nature of COVID and the response we've been seeing to it so far. This pandemic is arguably the greatest disruptive challenge that the global community has faced in 75 years. It was only 12 months ago this week that the first cases of the then unknown virus were identified. And since then, virtually no one on the planet has not been touched by it in some way. It's placed enormous pressure on economies and on industries, with some sectors experiencing unprecedented contractions and others, like the pharmaceutical and healthcare sectors, being forced to scale up important activities with unprecedented pace. And governments have been forced to respond in ways that previously seemed unthinkable or impossible. So turning now to how drug-resistant infections fit into this picture. We've heard a lot recently of AMR being referred to as the next pandemic, following COVID down the line, characterized as one maybe slower moving, but which over the longer run might be no less deadly. And even if drug-resistant infections have a slower burn impact and cause disruption, which is less acute than we see today from COVID, it's still a threat which has the potential to widely undermine the delivery of safe healthcare and to have a global impact that is significant enough to feed through to economic prosperity and development. And perhaps most pertinently of all, it requires a sustained, joined-up response across multiple sectors and across geographies. A business-as-usual approach is not an option, and as with COVID, no single country will be safe from drug-resistant infections until all countries take action. So for me, I think there are three areas where we should be looking for lessons and where I hope we can shed some light today. Firstly, there's a question of the scale and ambition of the response. We've seen governments seeking to get to grips with the fact that COVID, like AMR, is a complex and system-wide health issue where there is no single silver bullet. We can't just rely on vaccines or therapeutics or public behavior change or diagnostics and surveillance. We need all of these things and at scale. In acting on this, while many governments have occasionally stumbled with the enormity of the COVID challenge, we have seen that having huge political will to fix an issue can very rapidly get things done and unblock barriers to progress. Efforts to support vaccine development being the prime example of this, particularly with the news we've seen over the past couple of weeks. Also during COVID, I think there has often been some evidence, of a renewed appetite for global cooperation and a recognition of how important it is in tackling these truly intrinsically global problems. In AMR, we know that political will, domestically and at a global scale, is vital to making progress. And we have seen some important developments in recent years, like discussions at the UN, at the G7, and at the G20. But some of that momentum has perhaps been lost since the high watermark of the UN high-level meeting back in 2016. As we look beyond the initial response phase of the COVID pandemic, can we re-establish that political will and gain fresh momentum for the AMR response in the months and years ahead? Or will pandemic preparedness become a dominating focus for governments and a wider topic which other global health issues like AMR need to find a way to slot into? Secondly, there's the role of industry. During the pandemic, we're seeing companies at the centre of the response. We're seeing many mount heroic R&D efforts and finding new ways to collaborate, whether that's within their industry, with academia, and with governments, and scale up delivery of new diagnostics, therapeutics, and vaccines in ways we haven't necessarily seen before. Sometimes, admittedly not always, these have been backed up by extraordinary efforts from governments, philanthropy, and international bodies to make sure that funding gaps can be closed as quickly as possible, that the regulatory environment works as efficiently as possible, and that there will be ready global markets and supply chains. We know that R&D into these three vital sets of tools, diagnostics, therapeutics, and vaccines, is crucial to be able to tackle the rise of drug-resistant infections too. So what can we learn about how to support and work with the private sector and to make better progress delivering the tools we need? And as we're seeing with COVID, how do we grapple with the issue of how to put in place the right mechanisms to make sure that these innovations are accessible to those who need them in all parts of the world? And then finally, the third question for me is the role of the civil society and the general public. How will public attitudes towards global health issues like AMR change in the post-pandemic era? Will we see stronger buy-in to the idea of ambitious national and global efforts to fixing global health problems? And will this work to the advantage of the AMR agenda by making the threat of drug-resistant infections more relatable? And what more have we learnt about the role of civil society organisations in mobilising responses to major health challenges at the front line, at a grassroots level, and particularly in LMICs? All of these are questions that I hope we can start to get into a little bit when we turn to our panellists today. But before we do that, I'm delighted that we have a short video to start with from the brilliant Vanessa Carter. Vanessa is a committed advocate on antibiotic resistance and a One Health approach to tackling it. She was the founder of HCS MSA, that's an acronym for Healthcare Communications and Social Media South Africa. Hashtag HCS MSA is an ongoing Twitter chat that Vanessa moderates across a group of diverse stakeholders to discuss sustainable health development, particularly in digital transformation. In this short and very moving video message, Vanessa is going to tell us about her personal experiences as a patient impacted by drug-resistant infections.
When I was 25 years old, I had a car accident, and that resulted in many surgeries over a long period of time. I had a lot of damage to my abdomen and my face, but the face was the most complex of injuries that I ended up with. It ended up in 10 years of reconstructive surgeries. And so in my 6th year, because I had a lot of different prosthetics implanted to rebuild my face, the 4th prosthetic in the 6th year was implanted, and it ended up getting an infection. And this infection, over the year of me first finding out that I had the infection, I had a lot of debridements, I had a lot of reconstructive surgery. And eventually, when I had the implant removed in an emergency surgery, it was sent off for testing, and it came back that it was, I always say, riddled with MRSA, methicillin-resistant Staphylococcus aureus. And this was the first time that I'd ever heard of antibiotic resistance or this particular type of infection, which was resistant to the type of antibiotics that I was being prescribed and using, often. I had to look overseas to find information that antibiotic resistance wasn't common knowledge. That at the time that I was taking antibiotics, it didn't occur to me that if I stopped a course in the middle of it, it could be a risk to my own health. It could be a risk to the way that I was managing my infection. So that's what drove me towards advocating about antibiotic resistance, but not only from a patient perspective, but also from a communication perspective, which is what I do today. I guess the one thing that I would want to see change for patient inclusion is to recognize them as equal stakeholders in the fight for AMR, which is, in my case, has always been a struggle. It's realizing that experiences do matter, that it's not just about the qualification that you have. So this, for me, would be something that would be very, very important to overlook, especially when working with civil society members and patients, to overlook their qualifications and listen to the experience that they bring to the table. I think that stories are very key because, if something doesn't have a face, excuse the pun, but if it doesn't have a face, it kind of just is numbers, and it opens people's eyes. It opens people's eyes dramatically because they suddenly realize that we're not just writing policies on a piece of paper that's not going to change anybody's life. It literally is. It's influencing people's lives. So we need to do something about it. We don't have time to waste. We need to take control of it now. So that's what I also believe in. As I advocate, is this affected me. It affected my life. It affected my family. It affected my future. So it isn't just about me. I'm just acting as one voice. And I don't try to make it about me, but what I want to say is it's important that we try to establish other advocates, so that we really know that this is something that it's kind of like the iceberg, the iceberg effect, where you've got the AMR is just on the surface, right? The iceberg is just on the surface, but what actually happens underneath is much more substantial, and that's people's lives.
That's a very powerful story from Vanessa. I hope you'll agree. If you don't already, then Vanessa is well worth following on social media. You can find it on Twitter @_face_SA. She's very active currently around World Antibiotics Awareness Week in Africa in particular. So we'll now turn to our panelists. And as we do, a quick reminder that there will be plenty of time later on for questions and answers. We're all keen that this session is as active as possible. So do please submit your questions via the chat function as we go along, and we'll be putting as many as possible as we can to our speakers later on in the programme. But firstly, I would like to welcome Nana Kuo, who is Senior Health Advisor in the Office of the UN Secretary General at the UN in New York. Nana is a development economist and public policy specialist by training, with almost 20 years experience in global health, rural development, HIV and public health. She's currently the Senior Health Advisor at the Office of the UN Secretary General, and she provides policy and technical advice on global health, including on the UN's COVID-19 response, food security and nutrition issues. From 2013 to 2018, she led Every Woman, Every Child. That was a special initiative of the UN Secretary General to ensure the health and well-being of women and children everywhere. The Every Woman, Every Child initiative mobilized over 60 country and 150 multi-stakeholder commitments, totaling over $27 billion to deliver on the 2030 Agenda for Sustainable Development. Nana, thank you very much indeed for joining us today. So the first question, to kick things off, if I may. So you have extensive experience, as we've heard, in coordinating responses to health issues and to other emergencies at a national, regional and global level. What are the key lessons you've drawn from these experiences about the role that cross-sector engagement can play in delivering a more impactful, more effective response?
Thanks so much, Jeremy, and I thank all of the co-hosts today for bringing us together for this final webinar in this series. It's great that we're able to discuss an issue on antimicrobial resistance, particularly during this time of a global pandemic, COVID-19. So I would actually start by answering your first question in terms of drawing lessons from this COVID-19 pandemic. Which is as you mentioned already, one is the greatest health crisis of our age. We must learn from this tragedy of this pandemic to ensure that AMR is treated with the urgency and scale that it requires to prevent another devastating health crisis, which is a quiet but looming potential health crisis. The first hard lesson of COVID-19 is that the world really was not prepared. Global and country health and emergency response systems have been tested and found severely wanting. The pandemic has exposed and exacerbated weaknesses in health systems, showing that many governments neglected to invest in health, social safety nets, and emergency preparedness when it really mattered, which is before any crisis strikes. There is currently a huge opportunity to harness the world's political recognition for better health crisis preparedness and to leverage that for greater systemic investment across One Health to tackle antimicrobial resistance. Getting AMR politically recognized as one of the greatest future global health security risks should be a top priority for us over the next 6 to 12 months. And in particular, ensuring that investments in greater surveillance of these future health security risks is scaled up, particularly at country level. The second lesson is public trust and communication is key to a sustainable and effective public health response. During this ongoing COVID-19 pandemic, there have been large variations in response within countries. In some, there has been a lack of clear and evidence-based communication from the governments, which has incited growing fear and mistrust among its people. However, countries which have been the most successful in containing their COVID-19 outbreaks have implemented inclusive communication strategy using clear messaging to explain the public health interventions and why these measures were necessary for the long-term welfare of the people. This resulted in high levels of public acceptance and compliance with basic public health prevention measures and with the overall national strategy. So similarly, for a sustainable AMR response, we need the public to fully understand and engage to change their behavior to reduce antibiotic consumption and their role as consumers, and particularly, of course, within the consumption of food and the agricultural sector. And we heard our earlier speaker, that the power of that clear communication and how each of us can be an agent of change is so critical. The third lesson is that we are not powerless. If we know the science and demonstrate unity and solidarity across countries and stakeholders, we can overcome the pandemic. And we must join together as governments, the private sector, civil society, and all partners to make sure the new COVID vaccines, tests, and treatments are available to everyone, everywhere. A vaccine must be a global public good. This is the only way to get the scale that we need to be able to overcome this pandemic. We have proof that global coordination and a partnership approach can work and deliver. For example, we have the most viable global solution with the Access to COVID-19 Tools Accelerator, the ACT Accelerator as it's known, which is a groundbreaking partnership launched by WHO and partners, including the Wellcome Trust. The world's leading international health agencies are currently collaborating to accelerate the development, production, and equitable access to COVID-19 tests, treatments, and vaccines. In just 7 months, the ACT Accelerator has supported the fastest, most coordinated, and successful global effort in history to develop these tools to fight a disease. With significant advances in research and development by academia, private sector, and government initiatives, the ACT Accelerator is currently on the cusp of securing a way to end the acute phase of this pandemic by equitably deploying these diagnostics, treatments, and vaccines to the world, and most importantly, not just based on the ability to pay. It is impressive that countries have already invested $10 billion in the startup phase of the ACT Accelerator, but 28 billion more is needed to take it to scale and impact in all countries, which is the fastest way to end this pandemic. So what we can learn from this is that developed countries must support health systems in low and middle income countries that are short of resources, because global health is only as strong and resilient as our weakest health system. The ACT Accelerator is a partnership model that the AMR community can draw upon, especially how accelerated R&D and investments can deliver results when the vision and ambition of all partners are well aligned.
Thanks, Donna. There's lots of themes to come back to. I'm sure we will come back to over the course of this discussion. As a quick follow-up, so obviously you're one of the very senior leads with the UN Secretary General on AMR, and so you've been involved in a number of high-level discussions on AMR at the UN over a number of years now, including the Interagency Coordination Group a couple of years ago. How can the AMR community ensure that these UN discussions kind of regain some momentum? Obviously, we had the cancellation of the high-level dialogue back in April. And how can different sectors collaborate to play a role in this mobilization?
Thanks, Jeremy. I think that's a really critical question in terms of how to keep and sustain this political momentum. The United Nations recognizes that successfully reducing antimicrobial resistance is possible, but will depend on a number of key factors, such as first, a long-term perspective with sustained political leadership at global and national levels. Second, the deep engagement, cooperation, and coordination of sectors across One Health, focused on ambitious, innovative, and collective solutions. And finally, sustained financing at national and global levels. As you mentioned, we've seen significant progress on a number of these fronts in the past few years, notably since the 2016 UN General Assembly high-level meeting and political declaration on AMR, which helped to achieve prominence on the global political agenda. And we, following from that, of course, the Secretary General convened the Interagency Coordination Group, and we've seen its recommendation. But also, since that high mark in 2016, we have seen the One Health approach as being recognized as critical, leading to strengthened and institutional collaboration across the United Nations entities and other multilateral institutions working on the human, animal health, and environmental health. This tripartite partnership will lead the UN's response to AMR, and its focus will be fully supporting country implementation. However, sustaining AMR's political profile as an urgent priority over the long term is not guaranteed, and requires investment from countries and partners. And as we often see, new issues will emerge to take that political attention away from heads of state and government. And I think AMR community really needs to look at how to best leverage, say, the current COVID-19 pandemic and other opportunities to make sure AMR remains high on the political agenda. And particularly draw the links of why and communicate that very clearly. I think AMR sometimes is seen as a rather complex, and it is a complex issue, but also a technical issue. And we need to translate that into very clear messaging, and that resonates at the highest political level. I think this is why the IECG recommended the establishment of a global leaders group to advocate at the highest level and maintain this political momentum. The UN Secretary General has tasked the establishment of this high-level group to the tripartite agencies. And I'm glad to announce that the group's membership will be multi-stakeholder in nature and will be formally announced tomorrow. So please look out for that. And it will be co-led at the head of state, head of government level. The IACG also called for a multi-stakeholder partnership platform to facilitate multi-stakeholder engagement on AMR. It is anticipated that this platform will be established next year, and it will be a critical opportunity for different stakeholders to develop a shared vision for tackling AMR and a venue for enhancing collaboration. And of course, there is a strong interface between these various platforms with the global leaders group as well. So in summary, I think a successful and sustainable action to tackle AMR requires the entire global community, government, civil society, and private sector to work together across national and sectoral boundaries. And the United Nations is a committed partner to support countries in this global response.
Great, thank you, Nana, and very good to hear about the Global Leaders Group. I'm sure there'll be questions about that, and looking forward to hearing about that tomorrow. So moving now from the UN layer to over to Merthin Napundu. So Merthin is director of, well, he's the head of REACT in Africa. REACT, for those of you who don't know, is a civil society organisation, if I can say that, that articulates the complex nature of antibiotic resistance and its drivers. REACT plays as a catalyst, advocating for and stimulating country, regional and global engagement on antibiotic resistance by collaborating with a broad range of organisations, individuals and stakeholders. Merthin has been involved in the development of AMR national action plans in several African countries. He's a member of many boards and technical working groups on AMR. And he's also the partnership and engagement lead for Africa for the International Centre for Antimicrobial Resistant Solutions, or ICARS. So Merthin, fantastic to have you here with us today. If we can start, so thinking of your role at REACT Africa, one that provides technical assistance to countries on the development and implementation of their national action plans. How would you describe the role of multi-sectoral collaboration in the successful delivery of these plans in Africa? And can you describe a bit how you support governments in designing plans which bring in inputs from different sectors? Sorry, Merthin, I think you may be muted. Can we just double check?
Oh.
I can hear you. Great.
Yeah. Thanks, Jeremy, and thanks to the organizers. The previous speaker has mentioned that multi-collaborations are key to addressing AMR in a One Health approach. It recognizes the interconnectivity between people, animals, plants, and their shared environment, and recognizes that the health of humans, animals, and ecosystems are intersected. It recognizes that AMR is intersectoral in nature, and thus should be the interventions. The One Health approach that fosters collaborations should be used at all levels in managing the multifaceted AMR problem. From the conceptualization, development, and implementation of NAPs, there is need for a collaborative and multi-sectoral and transdisciplinary approach at all levels, local, regional, national, and global levels, with the goal of achieving the optimal health outcomes and containing AMR. The national action plans on AMR, though quite robust on paper, are mostly dysfunctional, and they are not being implemented in most countries. Are not optimally used AMR focal persons, who are usually bogged down by a lot of other responsibilities and financial allocation. Most of the country level at the AMR focal points are from a microbiology background, from the ministries of health of the national governments. Their expertise, experience, and outlook determine the way in which the NAPs are implemented. With little exposure to the policy space and food systems, most of the AMR focal points are forced to limit the NAP implementation process to their comfort space, and these are laboratories and focusing on surveillance and hospitals in human health sector, neglecting the food sector and other systems. The focal points cannot be blamed for this predicament, and most of the time they do not have access to resources to engage other sectors. Even when ministries may have a dedicated focal point, it is just another responsibility. As REACT, we engage with governments in supporting national priorities, such as prioritization of key strategies, such as optimization of antimicrobial use in both animal and human sectors through the policy development and implementation, development and application of guidelines, fostering multi-sectoral collaboration, building capacity, and mainstreaming AMR in already running programs at country level. Other activities that we support include advocacy, raising awareness, and sharing of best evidence and translation of evidence into practice, and working with antimicrobial resistance coordinating committees at country level. The key to successful implementation of NAPs is strong governance and structures that capacitates the AMR secretariats that currently are not supported by most government, provide them structural, technical, financial, human resources, and fosters the interministerial working groups. Strong governance and equally strengthen strategic resource mobilization for key priority activities in the NAP. They coordinate donor-funded projects, limiting duplication and ensuring that all sectors are actually included. By most measures of governance, many African countries lag in their abilities to deliver key public services necessary to address AMR. Even before the crisis, the delivery of basic services such as health, education, clean water, and sanitation has been lacking in most countries. National action plans are intensive and complex in nature, with broad activities that can only be achieved through successful collaborations. And so collaborations are very, very key, Jeremy, in terms of addressing a complex issue like AMR.
Sure. So it's very interesting to hear you say there about the existing challenges that countries in Africa had even before COVID hit. And so thinking of some of the measures introduced to address COVID, particularly in IPC, for instance, they've come about because of cross-sector collaboration. What can we learn from these initiatives and how they came about, and how do you think that should influence how we now respond to AMR?
Very interesting and quite important, because what we have seen with COVID is that the COVID response was actually, it took a high level response. Most of the countries formed these response teams that brought together government ministries, intergovernmental organizations, civil society, and they came together with a sense of agency, and they devised a plan in addressing this pandemic. These response teams and the committees had representation at the highest level of government in terms of leadership. There was political buy-in, and there was also the political muscle that was very evident. And some of these were led by the president, the prime minister, or the ministers of health. COVID-19 response had inevitably brought about cross-sectoral collaboration, as it became necessary for different ministries, including human, animal health, agriculture, finance, etc., to come together to actually discuss how best to actually address the common enemy, in this case, the virus. I'll give a classic example, of wash. Hand washing prevents the spread of infections. We saw collaborations of various ministries coming together: Ministry of Health, Ministry of Transport and Aviation, the Commerce Ministry, the Agriculture Ministry, the religious ministries, where hand washing was implemented at the entry points, into the shops, into the churches, in airports, in markets. And so there was actually a concerted effort to actually do that. These collaborations share a similar resounding message that we can actually do it even for MR. We've seen that hand washing and raising awareness, investing in emergency preparedness, low and middle income countries can leverage on the tranches of funds that have been received from the funding institutions such as the World Bank and the European Union and others. Basically, as part of the global response, last month the World Bank announced that they will be deploying 160 billion in financial support over 15 months to help more than 100 countries protect poor and vulnerable people. To support businesses and bolster economic recovery. This includes a 50 billion for African countries. These funds are aimed at strengthening the prevention and limiting local transmission through improved surveillance systems and training of frontline responders. They will focus on expanding testing and providing medical equipment such as gloves, masks, and portable ventilators, building or expanding healthcare facilities, building systems for real-time community tracing, scaling up communications and messages, are raising awareness about the spread in local communities, and also strengthening the coordination and collaborations, supporting regional institutions like the Africa CDC. These lay a great foundation in which low and middle income countries can actually use these systems to strengthen their MR response, because we should have actually basically a broad eye view and use the systems and the investment in COVID for AMR? Thank you.
Yeah, I think that's a really good point. Some common themes emerging already, and I think definitely it'd be interesting to explore the question of what that positive legacy looks like, not just in Africa, but beyond as well. So now we're going to turn to a very different kind of government context and speak to Michael Craig, who is Senior Advisor for the Antibiotic Resistance Coordination and Strategy Unit at the US CDC. So Michael leads the coordination of CDC's $170 million cross-cutting antibiotic resistance portfolio by developing and guiding CDC's strategic direction to address national goals to combat antibiotic resistance. He also works closely with the leadership of the US Department of Health and Human Services and with the President's Advisory Committee for Combating Antibiotic-Resistant Bacteria, or PACCARB, to use the easier name, I think, to align public health activities related to antibiotic resistance across multiple federal agencies. Michael, thank you very much indeed for joining us. So many people will know that the US government released very recently its second National Action Plan on combating antibiotic resistance. What are the key elements or the kind of new things in this iteration of the plan that you would want to highlight? And are there any particular insights you would want to share regarding the US approach to addressing AMR? Sorry, we've had Michael on mute, I think. There we go, I think. Maybe you're a Michael?
Can you guys hear me?
And now, perfect. Sorry about that.
Sorry about that. Well, Jeremy, I wanted to thank you for hosting this and moderating it, and I thank you to the co-sponsors and the co-panelists. And I also want to thank Vanessa. It was an inspiring video, and the courage that she had to fight her infection and then advocate for it is one that we need to take to heart. And Jeremy, I want to thank you for the question, because we did, the United States government did just recently release our second National Action Plan. The first National Action Plan was a success, and it covered the years from 2015 to 2020. The success that we saw in the US was critically important to show that we can prevent resistant infections. And we think it's a great model for a lot of different countries to look at in terms of how we approach things. And I do think that motto of prevention first is something that we have taken to heart, especially from the CDC perspective. We invested a lot of money in infection control and improving our data systems and improving antibiotic use. And it really did pay dividends. We saw over that time period that resistant infections in the United States declined by nearly 30%, and resistant infection-related deaths declined by nearly 20%. So those are real numbers and real prevention that we saw. And I think we looked at what was successful in the first plan and looked at what were the gaps that we needed to build on in the second plan. And we tried to chart out a path to build on that success even further and see what we could accomplish. And so I would note that I think the approach that we took in terms of leading with prevention and investing in prevention is one that we're going to continue to take forward. We're really doubling down on what we want to do in terms of infection prevention and improving antibiotic use across the healthcare sector, but across all the other sectors as well. I would note that the second action plan, like the first one, is a comprehensive One Health approach. So we take to heart what is happening in human health, what is happening in animal health, what is happening in the environment. Some of the new things that we're doing in the action plan are looking at new data systems so that we can actually get better data, especially data related to potential environmental antibiotic use and environmental resistance reservoirs in the environment. And also looking at new ways that we can prevent infections. We've had success at preventing infections in healthcare, but infections outside of healthcare, especially those in the community, we haven't seen the same level of prevention. And those are areas where we need to invest in new ways of preventing those. And so we importantly have some pieces in there about developing and trying to accelerate new vaccines so that we can potentially have new tools in our toolbox to prevent infections wherever they might happen. and also developing new ways of preventing infections when people are colonized with an antibiotic-resistant organism, so that they don't transmit that on either in a healthcare facility or onto members of the community. And then lastly, the thing I would note is that we really are trying to do more to build our support globally to other countries and to multilateral partnerships. I think with COVID, as the other speakers sort of noted, it is critically important for us to come together and work together to collaborate as a global community. And I think what we want to see is how can we, as the US government, how can we at the CDC help support other countries? I think the previous speaker really highlighted that action plans on paper are good, but we need to do a lot more to implement them, to resource them, to make sure that they have the heft behind them to actually accomplish that. And we're going to try and look for new ways to do that at the US.
I think that's a tremendously important point. And then kind of taking the lens towards COVID again. So can you kind of reflect briefly on some of the key elements from, in your view, responding to COVID-19 we can take into the implementation of a national action plan on AMR?
Absolutely. And I think you're going to hear a theme from me that it does come back often to us about prevention. And I think one lesson from COVID is if you can prevent a case, it's not only preventing that infection and potentially that death in that person, but it's also preventing future transmission. It's preventing that transmission to another healthcare worker, to another person in a nursing home, to a family member or a relative. And so prevention stops not only one case, but it stops the onward transmission of multiple cases. I think we need to take that to heart more in the work we do on any infectious disease, but especially antibiotic resistance. And I think that's one thing that we really need to focus on. And so some of the elements about IPC and how can we better come up with new ways of prevention and control, I think are going to be critically important. The other thing that I think we need to take to heart is how do we galvanize the public engagement, and how do we galvanize what has been built, as many of the previous speakers alluded to, around COVID, so that we can harness that energy for antibiotic resistance efforts. I think that that's true in the public sector. I think it's also true in the private sector. One thing I think just to note in closing as well is that COVID has really shown us the importance of public health and investing in public health. And if you don't invest in public health as a country or as a global community, it's not going to just impact your country or your community. It is going to potentially have shock waves that can go around the world. So investing in the private sector is important. Coming up with new modalities is important. But I think we know that we need the boots on the ground in our public health agencies to be able to support these things. And I'll just note that a lot of our investments in the US to support and prevent resistant infections here, those dollars have gone to our states, and we've supported with those dollars over 500 different people who are really the boots on the ground who are currently responding to COVID. And they've made a tremendous difference. And I think what we've seen is that's great, but it's really, we need to be doing even more and have more people on the ground who can respond to these, more engagement from our public health agencies.
That's great, Michael. Thank you. I think a lot of similarities there with Merthin's own comments. I think particularly prevention's coming through as a very kind of big thing. It sounds very simple, but I think more than ever, everyone is realizing the power of prevention. Thank you. Lots there that we'll come back to, I'm sure. I can already see questions coming in from the audience about precisely some of the things you touched on. So definitely things to return to there. We'll now take a kind of slight step change and now move to James Anderson, who is head of AMR at GlaxoSmithKline, GSK. So in his role as head of corporate affairs, corporate government affairs for GSK, James leads engagement with the UK government on delivering GSK's strategic agenda across R&D, manufacturing, commercial and corporate aspects of GSK's businesses. So in this, he seeks creative opportunities to partner with the government and to mitigate risks, and is a member of the UK Life Science Strategy Board. James also leads GSK's global advocacy on AMR. Through this, he's advised policy development on this topic at the WHO, UN, EU, European Commission, the O'Neill Review, as well as a number of national governments. He's vice chair of the industry IFPMA AMR committee and regularly speaks on this issue on behalf of the wider pharmaceutical industry, building on his role in developing the Davos Declaration and the UNGA industry AMR roadmap back in 2016. James also chairs UK-based work with the ABPI AMR network and the UK Government Industry AMR Task Force. So huge amounts of experience there in the pharmaceutical space on this aspect, and also working with governments in that regard. So James, thank you for joining us. So to start with, again, reflecting on COVID, what would be the kind of three things that you would see implemented either by industry themselves or by those leading the response, which have impacted, whether for better or worse, the ways in which industry have been able to engage with global efforts to tackle the pandemic? And then what can we learn from this in how we're trying to address AMR? Sorry, we're muted again.
There, maybe that's it. Yeah, really good. Thank you, Jeremy. As with others, really delighted to be here, and thanks to the organisers for hosting this webinar during World and AMR Awareness Week. So clearly, COVID has triggered a step change in a very sudden way for all of us. For the industry, that has meant working differently, and a number of the ways and things that we're doing absolutely do play through into AMR. And I'm going to pick on three areas where I think there's been step changes over the last few years that have really either been triggered by industry or enabled industry to work differently. So the first one is the launch of the AMR Industry Alliance. This is a group of over 100 companies, big ones, small ones, pharmaceutical ones, generics companies, diagnostics companies from all over the world, who all came together to get on the front foot around what they're doing on AMR and share best practices and also set targets for how to increase what's being done. And those span the broad areas that industry can really make a difference in. Clearly, R&D and creating new antibiotics and other treatments and tests that can help combat AMR. That's probably the critical thing industry does, and we'll come back to that in more detail. But the other areas are also very important. So we have some kind of role to play in making sure that they're used appropriately, particularly with antibiotics. But one of the ways that we can help do that actually is by preventing diseases in the first place, as Michael was just talking about in terms of prevention. And so many companies are investing into vaccines. Many make already huge quantities of vaccines that prevent millions of infections around the world and thereby reduce very significantly the amount of antibiotics we would otherwise use. Now, at GSK, we believe more can be done there, and it's great to hear Michael talking so positively about that as well. To give one example of the top priority pathogens listed by the WHO and by the CDC, GSK is already actively developing or has vaccines already for 6 of them, including Staph aureus and C. difficile. So that's a clear area where companies, and I think where we can learn from COVID of just what a difference vaccines make. Third area then is improving access to the products that we make around the world, where I actually think there's a lot more that needs to be done. And also in the fourth area of the alliance is about the manufacturing of particularly antibiotics and how we make sure that that is done responsibly, does deliver high quality products, and importantly, does not cause antibiotic leakage into the environment. So that really has been a great platform and has lasted a number of years, and we're just working on the strategy of what that will look like over the next few years. Two other game changers that I want to highlight briefly. First of all is Carbex, actually. So Wellcome and other funders have contributed significantly into Carbex, which has gone on to fund over 70 projects of early stage research, usually very small companies, not only, that are trying to create potential new antibiotics, novel diagnostics, and novel vaccines. And this has made a massive difference to the pipeline, because previously there was not enough early research going on, and that plays through for bigger companies that often pick up those projects and develop them through to patients. So Carbex and other initiatives, but have made a step change there, which then is starting to come through into the pipeline. Although, as we know, there are other problems in the later stages. And that has led to the AMR Action Fund, which I want to come on to later. But the other gap is the third game changer, which I think is the pilot of the subscription model that the UK government, the NHS in England, and NICE are running right now, which is to try a completely new way to purchase antibiotics. This will enable the economic circle to be completed, I think, if it works. And it's very different to how any other medicines are purchased. It has taken several years of multi-stakeholder work to design a model that we think will work. But as GSK and I think many other companies, we are cautiously hopeful that it will make a very important difference to the marketplace.
There's a lot to get into there, and a lot I'd love to come back to in the Q&A. Just very briefly, if you could pick on kind of one thing that strikes you as being the most important factor when it comes to good collaboration between industry and other sectors on this type of thing, what would you pick that as being?
Well, I would use the example of the AMR Action Fund as a great collaboration that's new, whereas the previous examples have been running for a few years. The AMR Action Fund was launched earlier this year. Jeremy and I had the pleasure to work together closely on this. The Wellcome Trust had done some early research into it, as had the WHO and the European Investment Bank. And then the IFPMA, the industry international body, came along, and we all worked together really in an intensive way around the table to find a balance for this fund, the AMR Action Fund, that will meet the highest public health unmet needs, will solve the problem in a way that works for everybody. And that has been what has enabled that to move forward. And I hope we can come back to that one as well.
Great, thank you, James. And yes, certainly having been involved in that, it's certainly been a very interesting collaboration to be a party to. Thank you, James. So now we'll turn to the kind of the last one of our panelists, Kathy Torkington, who is Director of Health Programmes at the Pew Charitable Trusts. Kathy oversees a team of policy experts, scientists and advocates for Pew's work on public health issues, the rise of antibiotic-resistant bacteria and the need for new antibiotics and safe drugs, healthcare products and food. She also oversees the Health Impact Project, which is a partnership with the Robert Wood Johnson Foundation, and represents Pew as a member of PACCARB, the Presidential Advisory Committee on Antibiotic Resistance. Kathy, thank you for being with us today. So, as a starting question, so Pew's work obviously spans across human and animal health in that One Health type approach we've already heard about. What are the current gaps that you see in addressing AMR through this type of One Health approach, and what activities are going particularly well as we do this?
Great. Can you hear me okay?
Yes, perfect.
Great. Thanks so much, Jeremy, for the opportunity to be here today with this great panel of diverse opinions and interesting insights into what we're seeing for AMR. As you note, at Pew, we are working on antibiotic resistance in both human arena as well as animal, recognizing, as we've all heard already, that this is an issue that spans many different sectors. It's global. It takes a massive approach from different angles. And so in terms of what we're seeing, what's the good news on both human and animal, we are seeing some progress, which I think helps illustrate that we can address this issue when we put our minds to it and when the political will and resources are there to do it. For example, in the United States, we now have about 90% of the U.S. hospitals with stewardship programs, antibiotic stewardship programs in place. And that's up from about 40% in 2014. That can be attributed to a couple of things, to CDC's leadership in developing what a meaningful stewardship program looks like, so defining that clearly, and then the U.S. government putting incentives in place to provide that incentive and the funding for hospitals to take that up and providing technical assistance. So that is an impressive, I think, step forward. And as Michael pointed out, we're seeing some progress in reducing some of those severe resistances in hospital settings, so demonstrating that stewardship programs have a positive impact. The gap, I think, on the human side is more around the outpatient setting. We know a lot of antibiotics are used in outpatient settings. We also know in research that's been done that, around 1 out of every 3 antibiotics in the outpatient setting is unnecessary. That's a lot of antibiotics that we need to be thoughtful about how we're using. The challenge in the U.S. side of that is that there aren't the clear federal sort of policy levers to pull to change that. So we're looking to other opportunities, insurance companies, health plans. How do we use what we've learned in the hospital setting using data, audit and feedback, information, and potentially financial incentives, but from some private sector players in this case. On the animal side, we have seen progress. It was a while back, but the federal government did require eliminating use of antibiotics for growth promotion and requiring oversight of antibiotic use by veterinarians, all good things. We have seen the Food and Drug Administration, which is the one that has some levers here, put together a 5-year plan with some good initiatives in it. And there are some steps that are being made in that direction. We did see some reduction in the use or in the sales of antibiotics in the United States from 2015 to 2017, shortly after some of these requirements or regulations were in place. I think the harder news is the last data we have, we saw a little uptick, though an increase in sales, and that's a bit concerning. So I think the areas of concern or gaps in the animal side are that uptick, and we don't have good data to know why that happened and where we're going in that area. We need better data, absolutely, to know which antibiotics are being used in which scenarios, so we can begin to understand where the opportunities are for improvement. And I might say one of the areas too in the FDA plan is on labels. We need to do a better job of making sure the labels on antibiotics for animal agriculture meet judicious use principles, and that's one of the priorities in the FDA plan. But so work to do. Progress has been made, but work to be done.
In many other areas, and kind of thinking briefly, applying the COVID-19 lens to that, do you think there'll be any kind of immediate are there kind of really big wins we can make in coming out of the COVID pandemic and addressing those issues, do you think?
I sure hope so. It would be certainly nice if this opportunity was maximum. We've seen so much horror from COVID. If we could find some silver linings here in terms of lessons learned and opportunities, then we need to seize on that. We certainly have seen the challenges of not being prepared, and there's so many analogies here with antibiotic resistance. We know resistance is here. We know it's going to get worse, which we didn't have as much foresight on that with the pandemic. We have no excuse not to be prepared. So I hope that what people have seen during the pandemic, they've seen the impact on everyday life. They've seen the impact on the economy. Is that an opportunity to really bring in a variety of people and to have them recognize we haven't been saying this just for the sake of saying it, that these things have an impact on our everyday lives. It has an impact on our economies. This is real. So I'm hopeful that maybe we can reiterate that messaging in order to get more attention and more action. I think we have seen, if the will is there, we can do amazing things. When you see the investment that's been made in the vaccines and the results that we're already seeing is phenomenal. And so it demonstrates when the political will and the resources are there, action can be taken. Obviously, there's some challenges with AMR and development of antibiotics is a little harder. It takes a long time, all the more reason to invest now and sooner. I'll just point out a couple of things that have been happening that I think, sort of trying to take advantage of the momentum. We have seen some money for antibiotic resistance in some of these COVID funding packages in the US. Not enough, but a little recognition that there's a connection of resistance, bacterial infections in COVID and needing to be thoughtful about that. We have seen that antibiotics have been demonstrated to be a very important tool in the toolbox for practitioners in trying to help the patients that they're seeing. And so we have seen some money on that. We've also seen some momentum on legislation in Congress to try to jumpstart the development of new vaccines in a bill that has, creating some money, a subscription-based model for some stabilization in the development of new antibiotics. And so we remain hopeful that some momentum can continue apace in that. One hesitation I have, and I don't want to end, I guess I'm ending on a lower note, but I do worry that we look at budgets as a result of all the money that's being spent on COVID, and that it has an impact on willingness and availability of resources for other critical issues like AMR. So how we balance that remains to be seen, but we'll have to keep fighting even harder.
Fantastic. Well, there is a positive note there, I think, to hold on to, Kathy. Thank you very much indeed. Thank you to all of our panelists so far. So we're running a little bit behind schedule, but we've still got about half an hour left for Q&A from the audience. So we've already got a number of questions coming through to us. So I'll direct some of these at the panelists, but obviously anyone who would like to jump in, then please do so. So to start with, we kind of know the medical community, the speakers we've had today are very aware of AMR, but we know that public awareness is a problem, and that in turn feeds through to kind of political will. And particularly in lower middle income countries. How can we kind of enforce this type of awareness and try and get the public more engaged on the issue, and in turn get politicians more engaged on that issue? Maybe I'll turn to Murphin first on that, if that's okay.
Yeah, thanks, Jeremy. It's been one of the major problems that we've had has been to get the political leadership really take the lead and have the great buy-in. I think some of the challenges that we've had have been around the understanding of AMR and its implications. I think one of the issues that we had earlier on was that the way that we explained AMR, because it's not a disease, it's not a condition, it made it very difficult to actually connect, both for the community and the political leadership. But I think what COVID has done is that it has actually given us a window of opportunity where we can connect to show that, if we don't have any treatments, these are the consequences. If we misuse the molecules that we have, these are the consequences. And really with getting the political buy-in, the political muscle behind the national action plans and the global action plan, will actually move a long way. But it will really take that sort of actually concerted effort, but also just the leaders to appreciate the enormity and the magnitude and the severe consequences that we are dealing with in terms of AMR.
Sure. That's really, really insightful, Murphin. And Michael, maybe you could come in on this one as well.
Yeah, and I would echo that. I think that was incredibly well said. I think COVID gives us the opportunity to engage the public in ways that we haven't before, because I think sometimes when we talk about public health or when we've talked about some of these emerging infectious disease issues, it's been very abstract for people. And COVID, as you noted at the outset of your comments, Jeremy, has literally impacted every human on the planet. And so we now have an appreciation of what emerging infectious disease can do, how it can dramatically impact our lives in ways that we never appreciated. And I think we need to take that as a learning moment, and how do we build messages on sort of a new reality of people having a direct experience that they can relate to? How can we use that so that people can be engaged? And I think what Murphin was is a great example. We're talking about potentially going backwards where we have infections that are untreatable. We can talk about prevention, as we noted before, and people can very much appreciate that preventing one infection can have an impact not only on that person, but on that community. And I think we need to really take that to heart and figure out how we can best maximize those messages.
That's a really good point, and I think certainly at Wellcome we found that there's a lot more we can do about how we kind of improve public engagement with the issue, and how we can be better advocates and portray what are very complex issues in a much more persuasive way. So we've also had another question around political perspectives, and I know Nana, amongst others, kind of talked about the need for political will to sustain momentum. But where we kind of sometimes find that that kind of political leadership is inevitably bound by election cycles, how can we kind of keep things moving forward, and how can we get the scientific or the advocacy community to play a role in kind of maintaining political progress? Maybe Nana, could I come to you on that one, maybe?
Yeah, great question. Thanks, Jeremy. I think that is one of the critical challenges in terms of sustaining political momentum. And we often see this in public health issues that, gain prominence, say HIV/AIDS in the 90s and early 2000s, but then over a period of time, sustaining that it requires a huge amount of investment. And I think similarly with AMR, we saw a high mark in 2016, but keeping that at the highest level requires that not only do we engage, highest level political advocates, but institutionally that these issues are, we have champions as well. So not only within the human health sector, the public health sector, but across the animal and environment as well. So it's building up those champions within the bureaucracies and institutions, as well as the previous question around public awareness and engagement. I think these all go hand in hand to add to that sustainable momentum on keeping this AMR agenda high up. And I think one of the key issues of why we need to keep it high up is the links to financing and investment. I think the kinds of systemic changes that we need to fully address AMR requires the scale of resources that we are severely lacking right now. And so how do we really ensure the kinds of investments that we need to make, at the system level are made over the next few years? I think this is the opportunity we need, and as a global community, and as the UN, that's something that we're looking at.
Great. That's fantastic. And maybe I'll turn to James as well, because I know he's obviously had a wealth of experience of working with some of these sorts of issues.
Thank you, Jeremy. So I was going to pick up on just a couple of the points already made. So first of all, from our perspective in the industry, we are really pleased with how the work we do to discover and develop new, effective, safe medicines and vaccines is now being talked about widely as a result of COVID. What that translates to as an opportunity for AMR, as already said, is to help explain why we need to be investing ahead of the curve in resistance. Now, the challenge with that, and again, I think we all know this well, is that we're kind of talking to governments about buying insurance, and who likes to be buying insurance, right? None of us. So there is a really concrete challenge. The last thing I would say, again, how industry is approaching this from our side is two things. So first of all, we are working with stakeholders, because I do think governments like to feel that they are responding to actions requested by multiple groups. So I do think being aligned on this, and I think there's great alignment, is very important. But the second one actually is to be proactive. And again, I'd refer to the Action Fund, which had 23 of the largest companies coming together. And that's unprecedented. They've committed $1 billion of investment into developing novel antibiotics, just the ones that we really need. And so what that does is buy time for the pipeline to keep moving forward, while in parallel, we are hoping and encouraging governments to take the actions that we need in terms of sorting out the marketplace.
Right, that's really helpful. And maybe I'll turn to Kathy as well, from a kind of a US-based perspective.
Sure. I mean, I was trying to think, one of the areas that we've struggled with, obviously, in antibiotic resistance and getting that political momentum is getting the voices that we need to advocate. Nana was mentioning HIV before. We were so successful because of the number of people that spoke out in favor of action. With COVID, I'm hopeful, it's sort of a strange way to put it, but there have been a lot of people impacted by this lack of preparedness, and also people that have needed antibiotics because of secondary infections or because of being on ventilators, that we have an opportunity to gain more voices in this fight. And people on the front lines in the healthcare field seeing again and again firsthand the value of these tools in a pandemic, in addition to so many common things we require for our modern medicine. So I think we need to take advantage of the fact that people are paying attention to this, getting those voices to join us, because it's that kind of people reaching out and talking to their political leaders about the importance that's going to help us move the needle.
That's great. I think that's a really important point. I was just immediately before this, I was on another World Antibiotics Awareness Week webinar looking at the role of the patient voice, or patient and practitioner voice, from the cancer community. And I think there was a very clear message that having a really strong patient community, a really strong kind of community of medical practitioners is hugely powerful. And if we can tap into the likes of the cancer community, diabetes community, other existing patient mobilization groups, that could be really powerful. Okay, so looking at some other questions now, I've got a kind of targeted question that I'll put to James in the first instance, if I may. So obviously we're seeing a lot of discussions at the moment around, or we've had discussions around the R&D side of things. We're seeing a lot of discussions that Nana alluded to around what can be done to improve access to COVID therapeutics and the partnerships that are being built to support that. James, can you say a little bit about either GSK or the wider industry's vision for what access to antibiotics might look like? How do we plug the access question into the R&D question you've already touched on, and what kind of partnership approach will that require? Are there learnings we can take from what we're doing with the Accelerator or COVAX, for instance?
Yeah, so it's a really good question, and as I touched on, I do think this is one of the areas where there's still a lot more work to do. So we should look very closely as we move beyond this acute phase of the pandemic to see what the learnings are, because I'm sure there will be some, but I don't think any of us know yet, kind of exactly what that will be. What I would say from industry perspective, there's two sides of the access debate in terms of access to the new antibiotics that are coming out of the pipeline as we speak, but also ensuring access widely to many of the older antibiotics that still play a critical role in patients' health all around the world. And there are issues with both of those sides that need to be addressed. When you look at the volumes of antibiotics that's used, around 97, 98% of all antibiotics are actually in the older category. And so from a numbers perspective, actually, I think we need to figure out what's still going wrong in that part of the antibiotics field first. It's had a bit less attention, but within the Industry Alliance, we are actively engaging with partners to try and unpick that. I think there's a lot of challenges that we need to work through, but we're committed to doing what we can. Similarly, on the new side, on the side of new antibiotics, again, what's missing, if you like, is anything equivalent to agave or some kind of, maybe the ACT accelerator can paint the way in that direction to figure out a new way to sort that side of the market out as well.
No, I think that's a really good point. And I know Nana mentioned the ACT accelerator in her introductory comments. So maybe if we could turn to her. Nana, do you have any kind of thoughts on, obviously you've been involved in some of the discussions around kind of getting the buy-in, getting the ACT accelerator off the ground. Do you think there are kind of lessons there with how we now address those issues that James just described?
Yeah, absolutely. I think, what the ACT accelerator or COVAX facility has been able to do in such a short amount of time has been quite impressive. And I think the key to that was the coming together of, the industry partners, the civil society, the multilateral institution, global health institutions, with a shared common vision. And I think what underpinned some of the success, of course, a lot of it was focused on accelerating R&D and getting new tools to the world to tackle COVID-19. But the other part of it was a recognition around the access issue, equitable access issues. That, just having a few countries have access to these tools isn't going to get us out of this current pandemic. We need to have access to all. And it was impressive that we heard, a group of the biggest pharmaceutical companies come together, to commit to this access issue, which was announced during UN General Assembly. And I think, we need to build upon that. The ACT Accelerator also has shown a new kind of model around how to incentivize R&D and how to finance that. And so I think that's something that we can also build upon. And particularly, of course, we've worked on a number of years on getting that pipeline of new antibiotics going with Carbex and others. But now through ACT-A, we're looking at this at a different kind of scale. And I think it's, getting new technologies through that startup phase is good, but to get to scale and to country requires that investment in the manufacturing, in the production and the distribution, and so across that whole value chain. And I think we need to look at this for the AMR issue as well.
That's great. Thank you, Nana. So we've still got plenty of questions coming in here. So kind of changing tack slightly. So we've heard a lot about prevention and obviously we know that in preventing improper access or improper use of antibiotics is a really important issue. So we've got a question here around what are the kind of practical things that we can be doing? What are the kind of the tangible transactional things that we can do to either prevent infections or ensure appropriate use of antibiotics? Maybe Murfin, can I turn to you on that one, given your experience of working with National Action Plan implementation in countries in Africa?
Yeah, I think what we have with the National Action Plans that have been developed, after the Global Action Plan, the foundational is around raising awareness and the knowledge around antimicrobial resistance, and I think that is the foundational building block. I think if we can we can sustain that, it will be able to actually support the other efforts that we do, whether it's in surveillance, whether we are looking at actually the conservation and the appropriate use of the current antibiotics and other antimicrobials that we have. And I think one of the things that was mentioned earlier, I think from the US, the example of having the stewardship programs in countries, in hospitals. In the US, they saw actually a 40% really increase in stewardship programs from 2014. I think one of the things that is lacking in most of the African countries is that we don't have actually stewardship programs in hospitals. I think that will be a critical intervention, and these are critical programs that will at least allow for the optimal use of the current antibiotics that we have. If we can start from what we can control the hospital practice, we can control what actually happens in the health facilities, but we cannot control much what happens in the communities. And so we start with the hospitals, and then we can actually then build up and spill out into the communities. But we have to have these interventions actually working together. Surveillance, stewardship, and also IPC programs that are actually working together in the health facilities, as we also promote biosecurity in the animal and veterinary sectors.
Sure, no, that's really kind of valuable insight. And maybe Michael, from your perspectives of tackling these issues from the CDC angle.
Yeah, absolutely. And I would echo Murfin's point. And I think that we have seen specifically, and I think we need to recognize as a global community, that healthcare facilities, especially hospitals and nursing homes where you have usually the sickest people, they're either going to be the places that you can control an infectious disease, or it's the place where you're actually going to magnify that emerging infectious disease across your healthcare sector and across your community. And I think starting there and making sure that you have rigorous IPC and that you have strong antibiotic stewardship programs, make sure that you can prevent things ultimately as robustly as you can at the places that are often the source and the focal point for your most vulnerable patients. And I think doing that is where you should start. And like Murfin noted, I think once you have a strong core there, I think building some of those pieces out into the community and also taking some of those lessons learned into the environmental sector, into the animal sector. How do we best track some of these uses? How do we best put policies in place that can make sure that antibiotics are used appropriately? And how do we extend infection control practices for some of these issues into the community, or come up with new ways of preventing things in the community like vaccination, so that we can better control those things outside of hospitals or outside of healthcare.
No, great. I think that's tremendously important. I think trying to balance that sort of kind of the well-regulated or relatively well-regulated environments in hospitals with the kind of much trickier environment of outside of hospital is a kind of a really good thing to think about. So we're coming towards the end of our time. So I want to give all of the panelists the chance to kind of give some concluding thoughts. So using my kind of moderator's privileges, I'm going to put them all on the spot very slightly. So we've obviously spent the past hour and a half talking around really how our experiences with COVID are kind of changing the agenda, or will potentially change the agenda on AMR. But kind of what's the one thing we can take away from this? What's the one thing that, taking out this conversation, that we want our countries, all the sector that each panelist represents, what can they do differently on the back of COVID to advance the AMR agenda? I'll kind of ask everyone, if they may, to keep their comments as brief as possible, but hone in on that one big thing. We'll kind of go in reverse order, and we'll start with Kathy, if that's okay, please.
Sure, thanks. And thanks again for the chance. The one thing I hope that we all take away from this is we have to be prepared. We know how to do this for antibiotic resistance. We know stewardship works. We know we need more antibiotics. We have a very insufficient pipeline of antibiotics that are even have the possibility of targeting the most severe superbugs. We know what to do. This pandemic has proven what happens when we're not prepared. So I hope that we learn our lesson, that it's worth some investment now to save a lot of heartbreak and further cost and investment in the future.
Fantastic. Thank you. And James.
So I fully echo that, Kathy. We've seen what happens when we're not prepared, when we don't have the medicines we need, we don't have the vaccines, and yet we have in AMR, we have the CDC, we have the WHO and other public health bodies that are telling us what we need to protect ourselves against as a global society. So my ask and industry is really keen that we find ways to work with the leading governments around the world, like we're doing in the UK, like the US government hopefully will do with the Pasteur Act, to create the economic conditions that attract that investment into R&D from our sector and elsewhere, such that we really are prepared and we'd have the tools we need to protect society into the future.
Great, thank you. And Michael.
Yes, I think it's a great question. And I would say foremost, to me, the response is to invest in public health. I've talked a lot about prevention, and for me, an investment in public health is an investment in prevention. And I think a lot of what we're talking about ultimately starts there. That if you have a strong public health agency, if you have a strong public health system, if you have strong multilateral public health organizations, that you're going to have the data, you're going to have the knowledge of where to invest further, whether you're investing in the private sector in terms of therapeutics or vaccines, or if you're just trying to deploy effective interventions like IPC or other controls across your government. I think it fundamentally starts there. And I think we have seen the peril of not investing in public health and not listening to public health and what ultimately that means for the transmission of emerging infectious diseases. And we have to learn that lesson, as Kathy noted, so that we can advance this for antibiotic resistance, as well as any other pathogens we don't yet know that are coming.
Great, good points. I know this always gets harder as you move down the line if you're the last panelist to be giving this sort of closing thought answer. So Murphy, we'll come to you next, if I may.
Thank you, Jeremy. This is a wake-up call, actually. I think, as Michael mentioned, I think we need to act now. I think that's the one thing for me, is that we really need to act now, and we need to find a way in which we can actually connect these lessons around COVID. We can connect to issues around how the impact is on universal health coverage, on SDGs, on the sustainable access, and also sustainable farming practices, because this is where we see really a lot of misuse and overuse, and sometimes lack of use of the critical and most needed antibiotics for antimicrobials. And so for me, it's let's act now as a global community, and let's work together. Thank you.
Fantastic. Thank you, Murphy. And finally, Nana, last comments to you.
It's the most difficult going last, because everyone said exactly what I wanted to say already. Absolutely. I think preparedness, investing in prevention, but having that long-term foresight and view, so that we can. But maybe just building on that, I think for AMR, it's that One Health piece. So coming from COVID, I think we had blind spots from animal infection disease jumping into humans, and that interface between animal health, human health, and environmental health. So how can countries really, fill those gaps, strengthen that interface in One Health, but also take that longer term view, because what we can see is, these big challenges that the world face really needs a system type of investment, and those types of investments need to be invested over time. Just 1 or 2 years isn't gonna solve our issues. We take climate change, we take this COVID response and preparedness. We need to invest in this over the long term.
Fantastic. That's been great. I think some really clear consensus emerging there from all of our panelists around really the fact that although COVID has been a horrendous experience for the world to be living through over the course of the past kind of 8 or 9 months, really there is an opportunity here, an opportunity to rebuild the case for the importance of investment in public health and investment in prevention, both at the kind of the local, the operational level, but also the idea of building up better and preparing ourselves for AMR or for these other unforeseen health issues which may come down the line. So really a chance to do that, a chance to learn from the type of innovative partnership approaches. That's another kind of thing that really comes through strongly. So hopefully we can turn this experience into one of opportunity and really take the chance to kickstart things on the AMR agenda in the months ahead, as we hopefully have new technologies coming through that will help us get through the worst of the COVID-19 pandemic. To conclude, thank you very much indeed for all of our panelists. And thanks also once again for everyone who's been working so hard behind the scenes today and over many weeks to pull this program of webinars together. I think particular thanks indeed to Diane Flehar of the Antimicrobial Resistance Fighters Coalition, who's done an incredible job of leading the development and organisation of these webinars from the outset. As I mentioned at the start, this is the last in this particular series, but the previous 3 sessions are now available to watch again on the Resistance Fighters website, as this one will be in due course. Finally, thank you, the audience, for joining us and for contributing such excellent questions today. Unfortunately, there were far too many for us to get through, even if we had a couple more hours. So thanks everyone for your involvement, and hopefully one day soon we'll be able to do these sorts of discussions in person once again, rather than from my living room and everyone else's living room. Thank you and goodbye.